Good day. My name is Christopher Denaque. Today I'm going to do the return demonstration of the parenteral drug administration, the subcutaneous injection. So, first is you need to check the doctor's order. So, checking the doctor's order, verify the patient's medication is being ordered in the doctor's order sheet. So, we need to check the medication administration record or the MAR. So, next is check the label on the medication carefully against the EMAR to make sure that the correct medication is being prepared. So this is to ensure the correctness of the medicine. So I'm going to check it later because in the next step we're going to check the medication. So next is follow the 3 checks for administering the medication. So we need to read the label on the medication. So first, when it's taken from the medication card. So and the second is before withdrawing the medication, and the third one is after withdrawing the medication. So this is to secure that the right medication to be being withdrawn is also the packaging, and the packaging has the same medication. It's much more efficient to recheck every time. Then next is to organize the equipment. Then the rationale for this is to promote the time efficiency and eliminate delay to the procedure. So I'm going to prepare the Next, prior to performing the procedure, introduce yourself and verify client's identity using the agency protocol. So the rationale, this is to verify that the administration of the medicine is being rendered to the right patient. So, good day ma'am, ako din si Christopher Denaque and I am from Davao Doctors College. O ako ang mga student nurse karon. So, pwede ba na ako mahibalan yung mga name and mga birthday po? Okay, so pwede na ako gamitin yung mga band. Okay, thank you, ma'am. Next is assist the client to the position which the arm, leg, or the abdomen can be relaxed depending on the side to be used. So the rationale this is to have a proper access to the site that is going to be used in the parenteral drug administration. So the patient is in supine position. We're going to administer the drug in the abdomen of the patient, so the patient is in supine position. So next is to obtain assistance in holding an cooperative client. So the rationale is that it helps the nurse to administer proper medication and also helps in distraction to lessen anxiety. Then so my patient is cooperative, so I don't need any other person or the other nurse to hold my patient. So the next step is to explain the purpose of the medication. So, explain the purpose of the medication and how it will help. So, using the language that the client can understand includes relevant information about the effects of the medication. So, the rationale is it is the right of the patient to know what medication they are going to be receiving. So, good day ma'am. So, today ma'am is atong baton na procedure is saksak og insulin sa imuha po. So, dili naman yung first time nimo na sa na-incheck ka nag-insulin today karon ma'am, no? Okay, so unsay mong gusto gamiton akong language? Kagets ka Tagalog po ma'am or Bisaya? Okay, Bisaya, so kagets dito ma'am. So karon ma'am is magsaksak og insulin sa ima. So asa na part tong gisaksakan og insulin sa ima sa tong last time ma'am? Okay, asa na part? Paano ma'am? Okay. Asa na kita? Dire. So, dire atong magkaon karon sa injection, ma'am. So, today is magsaksak ang insulin, ma'am. So, kabalo naman ta, ma'am. Iktas ako, ma'am. So, kabalo naman ta, ma'am, no? Kanang ang insulin is for sa atong diabetes. So, pag-lessen siya sa ato ang sugar po. So, step 9 is we need to select and clean the site. So, the rationale is friction aids in cleaning the skin. So, a clean area is contaminated when soiled object is rubbed over its surface. So, we need to select and clean the site. So make sure that when selecting a site, there is no tenderness, hardness, swelling, scarring, itching, burning, and or localized inflammation. So select a site that has not been used frequently. So is it because that the site where a skin appears to be healthy and free from irritation and inflammation reduces the discomfort of injection. Then next is we need to apply gloves. So before cleaning, we need to apply gloves because it protects from any form of discharges coming from the patient. So we need to don gloves. So, next, as the agency protocol indicates, clean the site with an antiseptic swab, starts in the center of the site, and clean in the widening circle to about 5 centimeters or 2 inches. Then allow the area to dry thoroughly. So this helps to avoid hemolysis and to keep it uncontaminated. So we are going to use cotton with alcohol. So we're gonna rub it on the patient's side. We're going to administer the injection. So next is to place and hold the swab between the third and fourth fingers of the non-dominant hand and or position the swab on the client's skin above the intended sites. And so this is to have an easy access to prevent the blood since there will be punctured skin after injecting the medication. So we need to clean the site. So gunita na ko, mama. Gunito na po. So discard the cotton ball in the proper trash bin. So next is we need to prepare the syringe for injection. So we need to remove the needle cap while waiting for the antiseptic to dry. Then pulse the cap straight off to the to avoid contaminating the needle by the outside edge of the cap. So this is to avoid needle prick injury. So we need to prepare the medication now. So we're going to administer 5 units of insulin to the patient. So this is before meal, every after or every before meal. So 1 to 2 hours before meal or 1 hour before meal. Then so the next is we need to inject the medication. So grasp the syringe in your dominant hand by holding it in between your thumb or fingers and fingers. So with the palm facing to the side or upward for a 45 degree angle insertion, or with the palm downward for a 90 angle insertion. Prepare to inject. Then this is just to give estimate on the area that is going to be inserted on the needle. So using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand and a firm steady push. So the rationale is this pulls the fatty tissue away from the muscle and makes the injection easier. So we need to administer the injection. So we are going to inject the medication by holding the syringe steady and depressing the plunger with a slow even pressure because rapid injection may cause discomfort. Pain is minimized by inserting the needle without hesitation. So we're going to administer now the medication. So ma'am, pag unito ko sa mga kuan mo, ma'am, mag-administer na ta ma'am sa mga kuan. So, remove the needle. So, remove the needle smoothly, pulling along with the line of insertion with the depressing your skin with a non-dominant hand. So, depressing the skin places counter reaction, and it minimizes the patient discomfort when the needle is withdrawn, and massaging the area may interfere with the test result by spreading the meds or medication to the subcutaneous line, tissue. So, we're not going to next is we need to discard the injection. So, dispose the supplies appropriately to the proper receptacles are used to eliminate others to be pricked with the needle syringe. So, I discharge the needle already. So, assist the patient into a comfortable position and flip down medication ticket for if not using the MER or EMR or EMR. So this is to promote the patient's comfort. So ma'am, itasan ako mama. So tarungan na ko yung position sa ma'am. Okay na sa position. Tarungan ko mama. Okay. So itaas na ako mama. So next is we need to do the aftercare and remove gloves. Then dispose the used items in appropriate waste receptacle. So returns the equipment or the other equipment to perform hand hygiene. So this is to prevent loss and to deter the spread of microorganisms. So So, we need to assess the effectiveness of the medication at the time is expected to act. So, some may experience anaphylactic shock or some may have a severe side effect. So, ma'am, dahil na to sa itong procedure po karon ma'am. So, if ever na kay ma'am batingan ma'am, like ka nang mahilo ka ma'am or ka na magsingot ganit ka ma'am or magsakit yung ulo or ka nang magka-feel ka panghina. So, i-inform lang ni mga attending nurse ni ma'am kay or ako, if ever ako pa ang kanang nasa ma'am on duty, so inform lang ko ma'am if nakay-debate, so magbalik ko ma'am for kanang i-monitor tika. So document each medication given, so we need to record the medication given, dosage, the time, any complaints for the assessment of the client, and the signature of the attending nurse or me. So if medication was refused or omitted, so record this fact on the appropriate record. So document the reason why. So we need to document the reason why the patient or why did the patient refuse to take the medication. So and the nurse's action according to the agency policy. So then we have recorded all the things needed to with the patients for today's procedure. So next is we need to dispose all supplies appropriately. So I'm done with aftercare, so I'm going to dispose the used items. So we need to dispose it in proper receptacles. I waste receptacles. So, thank you ma'am. Mabalik ko ma'am after if ako pa ang mga nurse. So, any complaints ma'am is i-report ni mo ma'am. So, thank you ma'am and good day.